Hey guys, welcome back to my channel, and welcome if you are new, and welcome to another video. So one of my very first videos on this channel, my second video to be exact, was a video talking all about Avery, just kind of introducing her to the channel, really talking about her conditions and kind of the struggles that she faces and where she was at in her development at that point. Now that video I made last June. We are now in March, almost April really, of 2023, and Avery is 2. Now that video is actually still one of my most viewed videos on my entire channel. I filmed it before I had a camera, so it was filmed on my phone. The quality is terrible, and again, because it was my second video, I wasn't very confident on camera. I made a lot of mistakes, I had to cut out a lot of it, and I just felt like I wasn't as educated as I am now. So I thought it would be a good idea not to recreate that video as such, but almost do kind of like a sister video to that one based on where Avery is at now, almost like a 2-year update. So if you are new to my channel and you have chosen this video instead of the old video, then this is my daughter Avery. Like I said, she is 2 years old. Now Avery has a lot of different conditions, but her primary condition is called HIE, which is short for, I can't pronounce it, I never have been able to. It's hypoxic ischemic something. I will pop it on the screen somewhere so you can see what HIE actually means, but I just can't pronounce it. But essentially what it is a hypoxic brain injury, and Avery's was caused by a 40-minute cardiac arrest when she was 3 days old. So obviously she was without oxygen for 40 minutes, which of course did some damage to her, and she has a lot of kind of subsequent conditions that are as a result of her brain injury. So Avery does have cerebral palsy. She is only 2, so cerebral palsy is still evolving in her. We won't really know where on that spectrum she is until she has kind of reached her limit with her development. She also has a condition called dystonia, which is a movement disorder basically, and what it means is that her brain signals her body to make involuntary movements that she can't control. So you will see her kind of stretching out an awful lot in this video. Usually that is her dystonia to thank for that. Now dystonia can be painful, the spasms can be painful in children, and I can only imagine, because obviously I'm not the one going through it, it can be very, very frustrating, especially since with Avery her dystonic movements are triggered by pretty much any stimulation whatsoever. So if we are trying to do a therapy, whether that be maybe tummy time or trying to do some prop sitting, her movements tend to get in the way of that a lot of the time, because she'll be concentrating, and then because she's concentrating, that will trigger one of her movements. So I feel like her dystonia is probably the condition that hinders her the most. Now her dystonia and her cerebral palsy, they kind of intertwine in terms of kind of how stiff she is. The neurologist still isn't quite sure on how much of it is spasticity from the cerebral palsy, and spasticity is high tone, so too much tone in her muscles, or whether it is dystonia that's causing her limbs to be so stiff. For the most part, her legs are pretty good. If Avery is relaxed, we can move her legs around pretty easily. She has pretty good range of motion and movement in her legs, so if she's laying on the floor she can kick about. She cannot yet stand on them yet, but again a lot of that is to do with upper body and balance as well. Her arms, we feel they do have some high tone. She can get very, very stiff in her arms. As a matter of fact, she doesn't have much use of her arms just because of how stiff they are. So again, when it comes to tummy time and prop sitting, we are very limited because Avery just can't seem to keep her arms stretched, and with a mix of her high tone and her dystonia, her natural position is to be like this, and her arms are very, very stiff, and it's just really difficult for her to do much with them. Now she can move them and we can give them a really good stretch, She does like a stretch. We've never really understood why. I don't know if it tickles her, but for the most part her arms are very, very tight. Now on the flip side of that, with her cerebral palsy, her trunk and core and neck muscles, they are all very, very weak. So she has low tone kind of all through this region, and basically that means that she can't hold her head very well. You'll probably notice that throughout this video. Again, she cannot sit unaided, and she has poor balance and coordination. Now she is 2, like I said, so that does not mean that that can't improve in the future. We have every hope that it will. The cerebral palsy and the dystonia are probably what kind of dominates Avery's day-to-day, but she does have some other conditions that again are most likely in relation to the brain injury. So she has severe reflux. Now she doesn't vomit a lot of her reflux is silent, and after a lot of tests, and she did go for a barium swallow, which is basically where they put kind of like a barium liquid that shows up on an x-ray. She had an NG tube at the time, so they put it down her NG tube and they basically have a look at how her stomach empties. Now her stomach emptied fine, but they did immediately see some free reflux from that study. She has also had a pH study, which is where they test the balance of the acidity between the stomach and the esophagus, and it was apparent that Avery does have severe reflux. And I mean, we can tell, we can hear it, you can hear her, you can hear things come back up, and then she kind of struggles with it when it gets to her throat. Moving on from that, since we're on the topic of Avery swallowing, Avery does have a weak swallow and poor coordination, and because of that she is 100% G-tube fed. She has been tube fed since her cardiac arrest. She did have an NG tube for the best part of a year. Actually, I think it was more than a year. And then we moved to a G-tube, which was one of the best decisions we made for her. It's so much easier on her, so much less stressful. We don't have to change the tapes anymore, and she doesn't seem uncomfortable by it whatsoever. But at the moment she is nil by mouth. There have been periods where we have been able to feed her small amounts of puree, but it's kind of like 2 steps forward, 1 step back. And I think if you have a child with complex medical needs, then you will totally get that, because it isn't a straight journey. It really is a rocky road. Things go wrong, you have to sidestep, you have to backtrack. And that really is how it has been for the last 2 years with Avery. So at the moment she is nil by mouth, and that is because she's had a bout of aspiration pneumonia. She's only had it, as far as we know, about 3 times in her entire life, but it does always make us quite nervous, because when Avery gets poorly, she can get very, very poorly and end up in hospital. Another condition that Avery hasn't yet been diagnosed with, but there is a strong suspicion that it's there. Again, with age, it's one of those things where they're gonna have to see kind of how she evolves, how she develops before they can officially diagnose it, is CVI, which is cerebral visual impairment. If you're familiar with cerebral palsy, then CVI probably won't be a new term to you, but I certainly hadn't heard of it before this little madam came along. And it's basically just a condition that affects how the eyes work with the brain. So some children may see double vision, some children may be blurred vision, and that may not be, you know, because their eyesight is poor. It's the way the eyes are sending messages to the brain, or the brain is receiving messages from the eyes. Some children see in 2D, and it kind of affects their spatial awareness. That was a new one to me. I didn't even know that was possible, but there are some strong suspicions in Avery and her symptoms that suggest that she does have cerebral visual impairment. But for the most part, she tracks really, really well. We know the structure of her eye is okay. She does wear glasses. She doesn't have them on right now, but she does wear glasses because she is short-sighted in her right eye, and she has stigmatisms in both. Now, before she had the glasses, she was still tracking. It was still obvious that she could see us and she could track us and follow us. but the glasses will just make her vision a lot clearer. Now the next, it's not a condition, but it is just something that Avery has experienced throughout her little lifetime, is seizures. Avery does not have an epilepsy diagnosis, but that doesn't mean she may not have an epilepsy diagnosis at some point in the future. We went a very long time seizure free, so she had quite a lot of seizures, back-to-back seizures, when she was in the paediatric intensive care immediately after her cardiac arrest, so within the first week. After that week, and after they controlled those seizures with medications, she was seizure free for a really long time, until around about last summer. She started to have a few what were called febrile convulsions at the time, and febrile convulsions can actually be common in any child, not just a child with cerebral palsy, but usually children grow out of them, and it is basically a fit or a seizure that is caused by a high temperature, by a fever. So she had a couple of those over the summer. They were really mild, they stopped on their own. We still took her to hospital just to get her checked out, but the doctor said it's not something to worry about. Even if she had another one, as long as she comes out of it, it's okay. As long as it's fevers that are triggering them, then it's okay. She still may grow out of them. Now we obviously knew that Avery would always be a sitting duck for seizures because of the nature of her brain injury. She is always going to be more susceptible to having seizures as she gets older. Now just recently, on her 2nd birthday, as a matter of fact, she had a bout of worse seizures. I don't want to say bad seizures, because I know that some seizures can be very bad, but they were bad in our experience because we've always seen Avery go into a seizure and then come straight out of one. She's not had prolonged seizures, she's not been really unwell afterwards, whereas the seizures she had on her birthday, we did have to rush her to hospital, and she did need medicine to stop them, and then that medicine lowered her oxygen quite a bit, so she then needed to stay in hospital all over her birthday to have oxygen. So yeah, when we spoke to the doctor at that point, he said that this is always going to be more likely with Avery. She's not likely to grow out of them the way a lot of children will grow out of febrile seizures, febrile convulsions. She is just going to be more likely to be prone to having a seizure when she has a high temperature. Now, whether or not other things would trigger seizures in her, we don't know, because we've not experienced it, but Avery has always been on levetiracetam, which is a seizure medication. She has always been on that, so that could potentially be keeping any seizure activity at bay. We just don't know. We're not going to test the theory. There is absolutely no way we're going to try and test that theory, but we do have to be much more careful when Avery gets sick, because a lot of the time she will spike a fever in the night when everyone's asleep, and by that point, you know, it's already too late, because it's usually the time that Avery first spikes that fever that she will start to seize. So yeah, we just have to be very careful when Avery is getting, or appears to be getting, sick. She's a little bit grumpy at the moment, guys, which is probably why you keep hearing her moan, and she's getting all stretchy. She was up at 4 AM, so she's probably getting tired by now, so I'm going to see if she will drop off to sleep in my arms like this. So those are the bulk of Avery's conditions, and in terms of her development and where she's at now, she is still at the development of a young baby, so I'd probably say no more than 4 or 5 months. Cognitively, you know, we can be told that she's around 3 or 4 months, but truly we don't really know where her cognitive development is, because she is pre-verbal. I'm saying pre-verbal because that gives an indication that she will be able to speak one day, and we've got no reason to believe that she won't. We're certainly not considering her non-verbal yet. She certainly likes to use her voice, so that is a good sign. Let's talk about the things that she can do and the milestones that she has reached since she was born in the last 2 years, because every single milestone, even if it is tiny milestone, it means absolutely everything, because when you have a child like Avery, you are just waiting. You're waiting for something to happen, and sometimes it happens when you least expect it. It completely takes you aback, and every time Avery has hit a new milestone, I have cried my eyes out. Avery can smile. and that was something we waited for a really long time, because we didn't know if Avery would ever be able to smile. And it was a slow and steady progress. When she turned 5 months, she started to kind of show facial expressions that looked similar to a smile, but then over the next 6 months following that, her smile just evolved, and now there isn't a day goes by when she doesn't have a smile on her face for at least part of the day. Avery can also laugh. Now this is a very new development. She used to make maybe a sound of pleasure, or you know, what could have developed into a laugh, and it was normally when we were doing something with her that was really high stimulation, so like throwing her in the air or something like that. She is an adrenaline junkie. And then just, I suppose, over time that laugh has evolved, or that sound has evolved, so it turned into a very short belly laugh, but again it needed really high sensory input. And then the other day, it was really recently, she was laying on the floor with Josh, my husband, and he was laughing, and she just started laughing, and it was the first time we'd heard her laugh like that without, you know, really strong sensory input, and it was a proper belly laugh, and it was a prolonged belly laugh. It was just so nice to hear, and now that she's done it once, I know that she'll be able to do it again. It's always few and far between to start with. That's what the smiles were like, but now I've got every hope that she's going to be able to laugh all the time one day. She has started, it's still very early days, but she started to intentionally try to reach or swat for things. Like I said, she doesn't have a lot of movement in her arms, so any kind of movement we get in terms of her arm development or hand-eye coordination is a really big deal for Avery. So again, her coordination isn't brilliant, so a lot of the time she will just kind of swat, and sometimes she'll miss, and sometimes it will take for us to put an object in her hand. But then she can grasp that object and look at it, which again is another really big milestone for us, because for so long Avery wouldn't look at anything she was doing with her hands, because her arms are always down so low, and her eyesight seems to be better above. So like even if she's watching TV, if she's laying on the floor, she likes to lay upside down and watch it as though she's kind of looking up at it. She seems to struggle a little bit more with her lower field of vision, if that makes sense. But yeah, any hand-eye coordination type activities, it's always a really big milestone, and we are starting to see a few little baby steps there, which is very nice. Her head control is getting better. Now the thing is with her head control and kind of her prop sitting and things like that, when she was young, she had what obviously still has high tone, spasticity, and she had a lot of tone in her upper limbs, in her shoulders, and a lot of her kind of head control, lifting her head up in tummy time, lifting her head up in prop sitting, it was more the tone pushing her into that position as opposed to her actually building the muscle strength. And we started baclofen, it was a good few months ago now, and her head control, it got a lot worse, it depleted, and even now it's still not back to where it was before she started the baclofen. However, the OT explained it to me in a really good way. She said that basically, because the tone was forcing her into the positions before the baclofen, it was more likely to be kind of false head control. It wasn't really doing anything for her in terms of building strength. Now that the baclofen has helped loosen some of that tone, she can actually get to work on starting to build that actual head control. So now the tummy time that she does and the prop sitting and the things that she does, that is all gonna help with her muscle control and help with her muscle strength, whereas before it probably wasn't. So that brought me a lot of peace, because I'm not gonna lie, when her head control started to get really bad after the baclofen, I wondered if it was the right decision and maybe we should come off it, but actually It just means that she's actually got more of an opportunity to strengthen those muscles herself instead of having the tone do all of her work for her. She is also starting to show anticipation, and she can definitely tell us when she is enjoying something. So we do a lot of work with Avery's portage worker, and it's basically like play therapy, but a lot of her targets are based around anticipation and showing pleasure and small ways of communication. So if she knows we're going to do something, she starts to anticipate it. And not just that, certain TV shows as well. So say for example we were going to put Frozen on the TV, if we start clicking towards Amazon Prime, she'd smile because she knew what was coming. And she definitely has preferences, we know this just by what she will and won't watch on the TV. She's very particular, not just about the things she watches and the things she likes to play with, seating and equipment as well. Now this is probably likely related to her dystonia, but she does not like to be strapped into seating, which doesn't help as much considering a lot of her equipment is there to try and support her posture and make sure her bones grow straight and grow the way they should. She can't stand to be in it. She gets very, very distressed. We do manage to get about 10 to 15 minutes in the stander, which is great. We can build on that, but she has a piece of equipment called an expander, which is a sitter, but it's quite robust. It's very I don't really know how to describe it. Put it this way, it takes us a long time to get her strapped into it, and it doesn't look very comfortable, I'm not gonna lie, but she absolutely hates it. By the time we've got her strapped into it, she's already so upset that we need to get her straight back out. So she does prefer to be in more relaxed forms of seating like bouncer, and she has a pea pod. She likes to be on the floor, just places where she can be relaxed and just be more free with her limbs. Same goes for the car seat and the pushchair. She doesn't like them at all. The pushchair we're getting a little bit better with if we are moving. I guess it's, I don't know, from the feeling of the kind of ground and the bumps. The second you stop, then she absolutely hates it. And the car seat, even after 2 years, we still haven't managed to build a tolerance to the car seat. Someone still needs to be in the car, in the back with her at all times when she's in the car, otherwise she does get very worked up, very distressed, and she can start to breath hold and aspirate, and we just don't want to throw herself into a seizure. So I still can't travel in the car independently with her yet, so that's a shame, but it is what it is. We did actually move closer to our local hospital just recently, just so that I can at least get her to her hospital appointments on her own without having to ask my mum or my husband to take time off work, which has been quite liberating. Avery can also roll over. Now again, a lot of these things, it's not something you see on an everyday basis, it's now and again, but I have witnessed her roll from front to back and I have witnessed her roll from back to front, so I know she can do it. The foundation is there. She is also starting to initiate when she wants more of something. So in terms of play, if we do something that she enjoys, she'll kind of wait for you to do it again. She'll kind of stop and kind of look at you until you do it again, and then when she sees it coming, what you're going to do, she'll start to smile. So again, it's all anticipation and initiation, and these are all really good skills to have. It's all improving her cognitive development, and again, it's a really good foundation for the potential of what she's going to be able to do when she's older or as she grows. Now I've already talked a little bit about what she can't do, but to be honest, I think it is quite apparent because of a lot of what she can't do are in terms of her physical disabilities. So compared to a neurotypical 2-year-old, she hasn't really met many physical milestones. That is okay. We have very much adopted the mindset that the main thing that is important in Avery's life, and to make sure she has a good quality of life, is her happiness. Often when I think about Avery not being able to walk or talk or eat, it makes me sad. But then I look at Avery and she's happy as Larry, kicking away watching Frozen. She doesn't seem to care that she's not on her feet. She doesn't seem to care that she's not sitting up. She doesn't seem to care that it's a tube feeding her instead of a spoon. It's harder on me, I feel, than it is on her. I think as long as we've got the right pain medication management, as long as we are trying to manage her conditions in terms of medications as much as possible so that she's not in discomfort, as long as she's happy and, you know, it's kind of slow progress, then I'm absolutely fine with that. Now there is kind of like a fine line with that. I mean, Avery doesn't like doing therapies that much. She doesn't mind tummy time, but in terms of the equipment and trying to get her to kind of sit and things like that, she doesn't enjoy it. And, you know, obviously I'm not making her happy by doing it, so that does kind of contradict what I've just said, but there is a fine line, because obviously these things we do need to be doing to set her up for the best future physically. So like I said, her bones are still growing, so the right posture support is gonna help make sure her bones continue to grow. Her stander is going to make sure that she doesn't develop hip dysplasia, or, you know, just to make sure she's bearing weight through her hips. Because if she's not doing these things now, we could set her up for a lot of pain in the future. If her body starts to grow in a certain way, it could cause her a lot of pain in the future. So we are also trying to be mindful that sometimes we do need to push her outside of her comfort zone, just to make sure that she's got the best future that she can have. Now, we do as much in terms of therapy as Avery will tolerate. She will not tolerate a lot. She will not tolerate things for a very long period of time. A lot of the time it is very gentle therapies. The most robust therapy she has really is getting in her stander, which we try to do a good few times a week. I would like to say I do it every day, but honestly I do not. Sometimes I just don't want to put Avery through it because it is an ordeal for her. By the time she's gotten in it, I can only get her to stay in it for about 10 minutes. It's a long process. She also has splints which I need to strap to her legs, and it's a whole process, and she doesn't enjoy it. So I do make sure that she does get in the stander a few times a week, just so that I know she's getting the opportunity to bear weight through her legs. We also do kind of some standing without the stander, so I'll pop her splints on, I'll pop her little slippers on, and I will just I'll help support her upper body in terms of balance, but I'll make sure she is resting the weight onto her feet and onto her legs, because she does have pretty good strength in her legs. She can hold herself up in terms of her weight. It's just because of her core balance and coordination, her upper body isn't doing what it's supposed to do, so she can't stand. We do an awful lot of tummy time. Tummy time is probably my go-to daily therapy at the moment, just because I really like the idea that we're building her head control. Avery's head is still very, very floppy at the moment. The amount of times she has accidentally headbutted us, I cannot count. But head control is a big one for me. Not just head control, but also trunk and core control in general, because over time, as her core strengthens, her balance should hopefully strengthen, which means she's got more scope to work on her coordination. Hopefully her reflux may get better. Everything kind of intertwines, like her reflux and her dystonia, they intertwine massively, because if she's got pain caused by her reflux, that will trigger her dystonic movements, and then her dystonic movements will exacerbate her reflux, and it is just a catch-22 vicious circle. And it is hard, I'm not gonna lie, it is really, really hard, but I think after 2 years, I'm definitely used to it. I'm much more accustomed to it. I'm not as precious when it comes to things. I don't think I get upset or hurt as easily. Now, I have my bad days, just like everyone. There are days when I just want to sit in the corner and cry and feel sorry for Avery and feel sorry for myself, but I don't. I carry on because this little lady needs my attention, and luckily she has definitely kept me grounded. Her and her brothers have definitely kept me grounded the last 2 years. I'm going to quickly go over the professionals that are involved with Avery, just because she has a lot of them. She has 2 occupational therapists. She has a disabled children's occupational therapist who deals with equipment and adaptations in the home. She has a community occupational therapist who is more the kind of physical therapy side of things. She does also have a community physiotherapist. She has a speech and language therapist. Now, this isn't for speech yet. She will eventually be referred to another speech and language therapist who focuses more on speech. But the speech and language therapist that Avery has now is more to do with her swallow and coordination and eating and whatnot. She has a portage worker, like I mentioned. She has a disabled children's family worker. She has a vision support teacher who she was referred to after the doctor suspected she had CVI. She does have an epilepsy nurse. Now, we were kind of stagnant with them for a very long time. Like I said, we recently gotten back in touch with them just so that they're aware of the recent events. She also has a health visitor, which we don't make use of very often. We used to when Avery would fit on the baby scales, but she doesn't anymore, and really what we use a health visitor for more than anything is weight, because that goes alongside with the dietitian. She has a dietitian because she is G-tube fed and she is on a G-tube feed. And then in terms of the actual medical side, she has a consultant and a community paediatrician. Eventually she will likely just have a community paediatrician because she kind of does a very similar thing. The reason why we still have Avery's consultant paediatrician on board is because she was actually the on-call paediatrician the night Avery went into cardiac arrest. So I have clung to her like glue because I know she's been there from the very beginning, and it brings me a lot of comfort, not just knowing that I know she has been with Avery from the beginning, but she has almost kind of gone through all the stages with us. She's been there right from the beginning, and I know we're not going to have her for that much longer, which is quite sad, but that is the reason we still have the 2 paediatricians. She also has a neurologist, and he kind of makes all of the final decisions in terms of anything relating to Avery's brain injury and her conditions as a result of the brain injury, seizures, things like that. So in terms of the medication for the dystonia, he's always been the one that managed that, so on and so forth. She also has a gastroenterologist, and this is quite a recent referral just because of the tummy problems that she's been having. She is taking a prophylactic antibiotic at the moment, and she probably will be for the foreseeable. Just because for a very long period of time Avery was getting ill all the time. It was back-to-back illnesses, and then she started to suffer with aspiration pneumonia, and then she started to suffer with low saturation levels with certain illnesses, and it was just a good idea to try and keep some of those illnesses at bay, because the pros versus the cons, it kind of worked in Avery's favour. But of course prolonged antibiotics are not good on the gut, so she is being seen now by a gastroenterologist, and I think the plan to tackle that is to try and get her back onto a blended diet this year. If you haven't followed my channel, you won't know, but we did try a blended diet for a short period of time, but because of the bouts of aspiration pneumonia we decided to take a break from it. But all of her doctors think that it'd be a good idea to start again just because of the benefits in terms of gut motility. She is also taking a probiotic, so that is just Yakult. We give her Yakult every day. In terms of Avery's appointments and the frequency, I won't lie, it's not as much as I would like. If I had more scope to get out of the house and Avery was safe to travel, you know, without me needing to be in the back with her, we definitely would have taken advantage of private therapies by now. But honestly, we just can't get to any of them, and it's so expensive to have them come to the house. So she has some kind of therapy, some kind of appointment at least once a week, but in terms of the main ones being physio and OT, she maybe gets them once a month, which isn't enough, but obviously I kind of learn from them, and then it's my job to do things through the week when they're not here. In terms of hospital appointments, I'd probably say she has hospital appointments most months, and it's just keeping an eye on things basically. Usually when she goes to hospital, it's either number 1 an emergency situation, number 2 it's an appointment where they're literally just checking up on something, or number 3 a test or a scan. So she does have a lot of hospital appointments. I've just kind of gotten used to them now. I'm gonna go over equipment just really quickly before I wrap up this video, because I feel as though I've been talking for an awful long time. Like, I don't know how I managed to condense this information into 10 minutes in that first video, because that was a 10-minute video, and I feel like I've just been rambling on for ages. I don't know, maybe it's because I feel as though I'm more educated now and I have more to say. But yeah, in terms of equipment, she obviously has her stander, which I've talked about. She has her expander, which I've talked about. I'm not gonna lie, we don't use it because she doesn't tolerate it whatsoever. She has her P-pod, which isn't really postural support, it's more relaxed seating, but it has better posture support than if she were laying on the floor or if she were in her baby bouncer. She has a bath support seat. We used to have the splashy seat. The reason we don't anymore is because our bath was too narrow for it. But the new bath seat she's got we actually prefer, because it lowers into the bath and she almost sits in it as though it's a hammock or a bouncer, and she is so zen in that bath seat. We absolutely love it. She has a specialised bed. She has the Dali bed short, and the reason she has that is because she needs to sleep on a tilt. just to see if it helps her reflux at all. But obviously a specialised bed as she grows is going to be helpful for her anyway, because it's not going to be that easy for us to get her in and out of bed forever. She also has a pulse oximeter, so a saturation monitor, and she uses that at night. It has saved her on more than one occasion, so it is definitely necessary. It just keeps an eye on her oxygen and her heart rate through the night. Obviously she has a feeding pump and all of the kind of supplies and equipment that come with that. And then she has her suction machine and her nebulizer. Those we tend to use more so when she's poorly, but again, she can get poorly quite frequently. The nebulizer just helps to loosen secretions on her chest that are kind of sticking to her lungs, and the suction machine helps to draw out all the nasties basically. And I'm pretty sure that is just about everything in terms of Avery's equipment, and I'm pretty sure that is a pretty good overall synopsis, very long synopsis, but a synopsis nonetheless, of where Avery is at now, the last 2 years, her conditions, just all about Avery basically, and what her life looks like as a 2-year-old with cerebral palsy. Now, everything I've said could almost make Avery's life seem a little bit sad. I assure you it is not. She brightens up our day. She has got a smile that would light up a room. She loves her brothers so much. She could watch them all day. She is just the happiest little girl. Now, of course, she is a 2-year-old. She has her tantrums. She has her bad days. But for the most part, she is such a happy little girl. She is the absolute light of this entire family's life. Her brothers adore her, Josh and I adore her, and we just would not be without her now. We try our hardest to make sure her cerebral palsy and her conditions do not get in the way of her having normal experiences. We do our best to still try and do the things we would have done before, but just adapt them to Avery, and I feel like that is basically what our life is. It's normal life with a few adaptations mixed in. So for example, we went to Disneyland Paris in July. It was difficult. We had to take a lot of extra stuff. It wasn't the easiest trip, but we did it, and Avery got to experience it. She got to meet Olaf, she got to go on the rides. We took her on the Pirates of the Caribbean ride, not knowing that there was a drop, and oh my goodness, Josh and I were terrified for her. She laughed her head off. She absolutely loved it. We are taking all of the children to Orlando next month, and I'm so excited for it. But those are just examples. We have taken them all to a kind of like a very small theme park, 1 county over, for the weekend, you know, just things like that. Now, we may not get to do things every weekend. We may not get to do activities all the time, or go and do things, you know, after school on a weekday. It is just too difficult. It takes too much planning to just do things on a whim like that. But with a bit of extra planning, a bit of extra time, we can still make sure that we as an entire family still get some amazing experiences, and Avery still gets amazing experiences. So all in all, I am really happy with that. And if you can take anything away from this video, it is that you don't have to be limited because of disabilities. You just have to work with them, work around them, find a way to adapt and navigate, and you can still have some pretty amazing experiences. So with all of that said, if you would like to follow us along on our journey, then please hit the subscribe button, and I will see you all in a few days with another video. Bye guys.